Super cool.
Yeah.
He's going to tell me what's up.
Yeah. Okay, so what did the other doctors tell you?
Tell me they found a little bug down here that they're not going to think about, and that they're going to attack this as much as they possibly can as soon as possible, and that we should get going on this, and it's going to be painful, and I'm good to go.
Okay, not much for me to say if they said all that.
Yeah,
so,
I know.
So they found a little
They've
spot.
covered a lot of things.
They found a little spot on the lung.
We're not going to worry about it. Maybe the chemo will get rid of it.
So we
could be an infection.
We're not sure what it is, right?
Right.
So.
So if chemo don't get rid of it, we'll talk about it later. A lot of it.
There is a guy here. I have to tell you something. There was a surgeon there at the meeting yesterday where your case was presented, who does robotic surgery.
Okay.
With a Da Vinci robot.
Nice.
And he's done a lot of cases at another hospital in town. He's waiting. I think he's just got privileges at this hospital to do it. And he thinks he can get that thing out.
Really?
If it's there still after chemo, he will be able to take it out.
I was electrical controls engineer. Is machine automation, which is kind of robotic.
Yeah.
So it's kind of cool.
You're into robotics.
I'm into it.
So
yeah.
you could have a robotic take that thing out.
I know.
He says a couple of days in the hospital. And they just poke a few holes in and then they get it out.
Let's get this chemo radiation going.
Right.
Let's see how bad I get my ass kicked, and see how much of this I can get rid of. Because it's building up.
Right.
It's not good.
We're going to start working on that. So today we're going to do a CAT scan in a mask. It's going to be like a mesh mask.
Right. Oh, you're going to put that on today?
Yeah, we're going to put the mesh mask
on. That's the 1:30 appointment I have?
Right.
Okay.
We're going to put the mesh mask on.
Okay.
We're going to do the CAT scan. And then we have to plan the treatment for about a week. And then you'll start.
Okay. And so then next week I can get the tube and the port.
So you get the tube, the port, then you're going to get the chemo and the radiation starting the same.
So on a third-ish. That's what you're thinking?
I'm thinking like the middle of next. Well, where are we? Thursday. I'm thinking the beginning of the following week, right?
Not next week. The one after.
Yeah.
So that
because
third-ish.
we're already Thursday.
Yeah.
This week. I'm talking about like 10 days. So.
Yeah. Okay. That's going to be like the third-ish.
Right.
Because that's what they're thinking over there.
Right. Day before the 4th of July.
Yeah.
Like that Monday.
That's what. Yeah.
Either the Monday or the Wednesday.
That's what she said.
Well, the Monday would be the...
Yeah, that would be...
Yeah. The Monday would be the 3rd. The 4th would be a day off, and then the 5th would be the Wednesday.
Yeah.
So we'll either start the Monday or the Wednesday.
Yeah.
Okay. Who's your doctor there? Bob McConty, right? The med-doc.
The girl that smiles all the time. The Indian. She's Indian? Or...
Bob McConty, I think.
Yeah, I don't know.
Hang on, I can look over here. I think I have her here. Now, Lassick is the ENT surgeon. And I think it was Bob McConty, yeah.
Okay.
With a ponytail. Yeah, it is Bob McConty, right? Yeah. Okay, so that's the plan. The plan is to do radiation and chemo, and you heard it's going to be rough.
Yeah.
You're going to lose your beard, lots of your beard, not this part, but the sides.
I'm not worried about it. I can grow back.
And the skin's going to get red like a sunburn.
Okay.
And the mouth's going to get very sore and dry, and you're going to lose taste.
Okay. Oh, I'm not going to be eating too much anyways.
That's what the tube's for. So you can just feed yourself through the tube. You don't have to put food in the mouth. But you still have to try and drink a little bit and practice.
I'll be drinking coffee the whole time.
Practice your swallowing.
Yeah.
Keep it in practice.
Yeah.
Because if you only use the tube and you don't put it in the mouth.
No, I'll be drinking coffee.
Right.
If I can eat like cottage cheese or something, I'm totally into it. I love to eat.
So eat what you can.
Yeah.
And drink what you can,
Yeah.
and the rest you'll put in the tube.
Yeah.
This will only be up to about 3 or 4 or 5 weeks of the treatment.
Right.
Treatment's going to be 7 weeks. Every day, Monday through Friday.
Let's go.
5 days a week.
Let's go.
Okay, you ready to go? Okay, so I have to fill in this consent form.
I don't know if it's all hit me completely, but I think I have a pretty good grasp on what's going on.
Okay, good. Okay, so I'm going to fill in this form. I'm just going to put head and neck here. And these are all the possible side effects. Have you ever seen an ad for any medication on the TV where they give you all the side effects?
I don't watch commercials.
Okay.
Oh, but yeah, I do.
I mean, I don't watch TV either.
I don't want to. I'm sure that the side effects are phenomenal. She told me about the hearing loss and about the kidney possibilities, but I'm in good health. I have good blood pressure. I don't take any drugs or alcohol, so I don't have any complications there. Good pulse, good metabolism. So, I mean, prognosis is, I believe, pretty good.
Well,
and I think the doctors agree with that, too.
We're going to go after it hard.
Yeah.
You're going to get full treatment.
Yeah. Kick my ass. I can sleep it off. I don't care. Right? I have no other thing going on.
Okay, hang on a second. What's the date today? It's the 22nd, right?
Yeah.
22nd, 17. Okay, so you need to read this.
Yeah.
And then sign the...
Do I really need to read it?
Well, those are the side effects. These are all the possible side effects that you'll get.
All right.
I've ticked them off.
What's the other one with the blood?
Mostly from chemo, your blood count will go down.
Yeah.
But we'll watch that. So if you could just sign a date, and then we'll take you off to the. Someone's going to come get you to go to the CAT scanner and get the mask made. Okay.
I like everything's right here too.
Right, we'll do it all here.
I've been here since 9 o'clock this morning.
So, who have you seen? You've seen
everybody.
You've seen Lasik?
And I've seen the chemo.
By McCarthy.
Yeah, I've seen the social worker.
Social worker.
You.
Yeah.
Now I'm going to get the mask.
Yeah, a lot of appointments. And a CAT scan. Don't forget
You're going to do another CAT scan?
Yeah, that's what we have to do in order to plan the treatment.
Put the mask on and then do a CAT scan, then you have your alignment.
Right.
Got it.
Then we send it to the computers at the back.
Got it.
That's how we plan the treatment.
But the mask, okay, got it.
Right. Did you see the movie?
Yeah.
The movie shows you how we...
The PT?
You know the movie?
Oh, yeah.
Yeah.
I stole that movie, by the way. I have it on my floppy.
Yeah, so you can watch and see how we plan the treatment. You know, we draw out the...
But all the movies you downloaded are in Spanish.
We did?
There was a bunch of them in Spanish.
I guess they have a lot of Spanish patients here.
No hablo español.
They have a lot of patients from everywhere here.
Oh, I was in the elevator. There was 4 different languages going on.
I met a Tibetan, someone from Laos, someone from Guatemala.
Well,
who knows?
Here to get treatment.
Right, yeah.
That don't live here? That are
No,
just
they
there
live here and get treatment here.
Yeah.
No, here.
We have a lot of different nationalities in this area.
Somalia, Kenya.
I live in a Somalian neighborhood.
You live in a Somali neighborhood.
Yeah.
A lot of Somalis here.
Yeah.
Okay, so you're good with that. So I'll go and get
we're good.
Yeah.
Good to go.
Okay. Good to go.
Thanks, Doc.
Okay, have a seat. She'll come get you.
Well, can I go get her?
No.
All right, I'll leave you.
No, you know hospitals. You have to be sure.
Oh, I don't have it in me.
Okay.
Thanks. Okay, that's doctor number 3, and this is a go. So, what they do is they're going to make a mask, okay? when they're done making it, I'll get a picture of it. But what it does is it covers your head, and it's like a cast that holds your head to the table. And what will happen is that'll hold you perfectly still, so that, like, just imagine your Adam's apple, my Adam's apple. Every time they put me on the table, it'll be in the same plane, at the same angle, at the same position every time. And so now when they bring the radiation machine in that points radiation into you, they always know where to shoot it. And it's going to take them a week to calculate based on the CT that they take today and where they want to attack the calculations for the radiation machine. I don't know how that looks like. We'll get into that later. If you guys are into this, having fun, but I don't know. Something for me to do. If I'm missing something, or you guys want more comments or less comments, I know that today the doctor's stuff, they're kind of long because I want everybody to know the details, so I'm not alone. But anything else you want to see or want me to do different, let me know. Yeah, and thanks for caring. All right, bye.